Okay, wonderful. Again, my name is Angel Fabian, and I am the Advocacy Coordinator with the Fíjate Bien program at Impact Global Action. And you are joining us in the second session of a series of workshops that we are offering with community members to deepen our advocacy knowledge and advocacy tools. As some of you know, Alzando la Voz was a project that we initiated last year that is based out of the Speaking Out curriculum that we had implemented for the past 10 years with community in predominantly the Global South. And so we brought it to the US and specifically focused it on the Latinx, gay, and bisexual communities. We did 4 workshops or training sessions, one in Oakland, one in Fresno, one in the US-Mexico border, and the last one in Puerto Rico. And some of you may be joining us from one of those trainings, so welcome. And to deepen or continue building on the advocacy work that we do, we have invited some amazing individuals that will be sharing some of their experience doing advocacy work at the local level. Specifically, we have been privileged to be involved in some of the work that is happening here in California. And so we brought, invited some folks who are doing some amazing work in coalition with other community members. So this workshop's called Nuestra Voz, Nuestro Poder, and it's advocating with elected officials. It's part of the Alzando la Voz project, and we will be extending for 2 more workshops in the series, and culminating with a Leadership Institute. So with that, I am going to share with you what we're going to be looking at today. We're going to do a welcome and introductions. So everyone, especially because there's a small number of us today or this morning, we'll get to an opportunity to know who's in the room. So we'll do a welcome and introductions. We'll do a brief overview of the previous workshop. Then we'll have Sylvia Castillo with Essential Health Access share with us some of the work that she has been deeply involved with the California and in the Epidemics Coalition. And then Michae de la Cuadra with the Translatin Coalition will close us out with their knowledge and their experience with AB 2218, the Transgender Health and Equity Fund. Then we'll close with the next webinar, Follow the Money. And I included honey in there because it's important for us as advocates to continue following the resources, especially as they reach or do not reach community. And that's scheduled for next Tuesday, the 8th. So I am going to ask everyone, and I will stop sharing my screen, but this is, oh, sorry for the typo there. So if you wouldn't mind, I'll be calling out your name. And please let us know your preferred pronouns, the organization or the country that you are joining us from, and answer this question briefly. What has been your experience doing advocacy work with elected officials? Okay, so I am going to stop sharing my screen. And again, a name and preferred pronouns, organization, and country, and what has been your experience doing advocacy work with elected officials. Okay, so why don't we start with Charles? Charles, if you can unmute yourself.
Hi guys, my name is Charles. My pronouns they, them. I am in Nairobi, Kenya right now. And experience with politicians, that's a barrier we're trying to break because of stigma and discrimination we face down here, and the constitution also criminalizes our community. So it's a barrier we are hoping to penetrate. some a little more sensitive about it right now, and we are hoping to get some resources to map that journey right now. Thank you. Appreciate it.
Charles, which organization are you with again?
I'm with an organization called Team No Sleep. We advocate for the LGBTIQA+ refugees who are going through the resettlement process, and they're all seeking asylum in the country. And the community that we advocate for comes from the refugees from all over East Africa, Uganda, South Sudan, Rwanda, Burundi, and the DRC.
Wonderful. Thank you for joining us. And I know it's very late for you, so thank you for making the effort. Why don't we go with Anselmo?
Hi, everyone. My name is Anselmo Fonseca, and I am the Program Manager for AIDS United in Puerto Rico. Thank you for having me.
Thank you for joining us, Anselmo. Elizabeth? Hi, Elizabeth. Could you unmute yourself? Okay, Elizabeth. Then let's go to Lucinda.
Hi, good morning. My name is Lucinda Balsomi. My pronouns are she, her, hers. I am in Connecticut. I work for Advancing Connecticut Together, which is a nonprofit organization that provides, amongst other things, support services for those who are affected by HIV. My legislative experience has been, I did participate in AIDS Watch back in April and did get a chance to do Zoom meetings with our Connecticut legislators to discuss community health issues and support services that are surrounding our population in the Hartford area.
Wonderful. Thank you, Lucinda. Thank you for joining us. Let's go to Marissa.
Hello, good morning, everybody. Marisa Corpus, pronouns are she and hers. I am with Fresno Barrios Unidos here in California, Central Valley area. And the question was the experience with legislators?
Exactly, or doing any type of advocacy with elected officials.
As far as advocacy with elected officials, it's been at most like legislative visits, and especially within this last year, it's been virtual or calls. So that's been really cool and convenient. So you don't have to travel several hours to Sacramento for like a 10-minute meeting with a legislator. So you're in the comfort of your home. So yeah.
Wonderful. Thank you. Welcome, Marisa. I'm getting a note from the interpreters. If you could please get closer to your microphone. They're having trouble hearing you. So thank you. If we could go to Miguel Ángel Delgado Ramos.
Buenas tardes. Mi nombre es Miguel Ángel Delgado Ramos. Vivo en Sidra, Puerto Rico, en las montañas. Ya había participado de algún taller específicamente que se llevó a cabo acá en Puerto Rico con Ángel Fabián. Así que encantado de verle nuevamente. Saludos a todo el mundo allí en la sala. Soy el copresidente de comunidad del grupo de planificación para la prevención del VIH en Puerto Rico. Además, también pertenezco a la junta de directores de un centro de salud comunitaria que se llama COSMA Incorporado. Y junto con mi experiencia con legisladores, pues ha sido a través de AIDS Watch, ¿verdad? En esa plataforma tan espectacular. Además con la Asociación de Centros de Salud Comunitario, que hemos tenido la oportunidad también de capacitarnos en en el área de cómo accesar a los legisladores y tuvimos esa experiencia, ¿verdad? De visitar algunos legisladores en el Capitolio y además por medio de cartas a alcaldes, de gobiernos municipales, a jefes de agencia, básicamente. Muchas gracias por la oportunidad.
Muchísimas gracias por acompañarnos, Miguel Ángel. Just letting folks know, when someone is speaking in Spanish, we can all go collectively to the interpretation, and they will be interpreting in English. My apologies for not mentioning that. Pero muchísimas gracias, Miguel Ángel, por acompañarnos. Thank you, Miguel Ángel, for joining us. Let's go to Trevor. Trevor?
Hello, Angel. This is Trevor Stratton. I'm, what am I doing here? I'm talking about my pronouns are he and him, and the organization. I work for the Canadian Aboriginal AIDS Network as their coordinator of the International Indigenous Working Group on HIV and AIDS, and it's hosted here in Canada. My experience with advocacy, you know, at international AIDS conferences, we have a meeting with the Minister of Health of Canada, because Canada is the host, and we bring, you know, certain asks and just get a certain feel for where the minister's coming from, and let them know what our concerns are. There's also an all-parliamentary global health caucus that in Canada that looks at TB, HIV, and malaria, and we have a campaign every year called Aboriginal AIDS Awareness Week, where we have a parliamentary breakfast with primarily with the caucus, but other civil society and lots of MPs and some ministers come, maybe 12 or 13, and then also you know, attending different UN functions, and you know, I did 3 years on the, what do you call it, UNAIDS NGO delegation, where you end up meeting a lot of officials, and especially a lot of lobbying, you know, between the meetings, which is where a lot of the magic happens, when you get to walk up to the people who won't answer your emails or telephone calls, but they'll talk to you and you're right in their face, you know. So I learned a bit about how to do that and be prepared for those meetings that you don't know who you're going to meet, but you got to be ready. So yeah, thanks.
Awesome. Thank you for joining us, Trevor. And let's go back. I'm sorry, let's go back to Elizabeth. Elizabeth, if you could unmute yourself. Oh, okay. Elizabeth's telling us that, hello everyone, my video and microphone are not working. My apologies. Pronouns she and hers. I work for the True Care Health Center in San Diego, California. I do not have experience with advocacy with elected officials. I'm here to listen and learn. Thank you for having me. Thank you so much for joining us, Elizabeth. And last but definitely not least, I'll hand it over to Sylvia to do a brief introduction, and then I'll go to the overview of the previous webinar. Sylvia?
Buenos días a todos. I'm Sylvia Castillo, and I'm excited to be here with you all today. I work with an organization called Essential Access Health, and we focus on protecting and expanding access to sexual and reproductive health care here in California and beyond. And our primary space that we work with Angel and our partners at the End The Epidemics Coalition is working on preventing sexually transmitted infections. My pronouns are she, her, and ella, and I'm based here in Southern California.
Awesome, thank you so much, Sylvia. And we'll come back to you for the presentation, okay? Anyone else joined us? No, I think that's everyone. So welcome everyone. And it feels and it seems like there's a whole breadth of experience and knowledge and wonderful skill sets that hopefully we're going to try to make this workshop as engaging as possible. We are going to hold off on the questions towards the end, but of each presentation, but please feel free to write stuff down as it comes to you, so that we can have a lively conversation. I'm gonna continue sharing my screen. So we did the introductions in sharing some of our experiences. Just wanted to do a brief overview of our previous webinar. Um, um, 2 Tuesdays ago, we were able to kick off this workshop series with ¿Sabías qué? Did you know what in translation into English? And it focused on using research tools for advocacy. In it, we had two breakthrough initiative presentations. What we were able to do with some of the training sessions, especially the ones in Fresno, the US-Mexico border, and in Puerto Rico, was offer the opportunity to fund organizations to continue doing their advocacy work that was community-driven. And so organizations applied, participants from those workshops applied, and two were funded. One in Fresno, one was Fresno Barrios Unidos, and they presented at the last webinar. And the second one was Valley AIDS Council and some of the work that they were able to carry through. It wasn't a lot of funding, but it hopefully opened up more opportunities to be able to engage community members and continue resourcing the needs for those communities. So we had a brief presentation on by those two organizations, and so thank you. Some have joined us again today. Then we went into a discussion on community action participatory research. And Sonia Arriola with Arriola Research and formerly with Impact kind of gave us the theoretical framework, why community action participatory research and its connection to popular education and Paulo Freire. And so it was really a pretty amazing presentation. And she ended that presentation with a concrete example with the Gay Men's Health Survey, which collected thousands of information from men across the world with regards to what conditions, good and bad, they were facing with regards to accessing HIV prevention care and services. And then we were joined by Lindsay Dawson from the Kaiser Family Foundation, who will be joining us next week, actually, for the next webinar. And Lindsay shared on HIV data tools that are available for free and that we could utilize to, strengthen, our approach, our advocacy efforts with actual data. So Lindsay presented different data tools from the CDC, from HRSA, from SAMHSA, and from the NIH. And if you missed that webinar and you are interested in any of that information, there is a recording available on Impact's YouTube channel. So please go to the YouTube channel and let me put it in the chat. I believe I can put it in the chat. No, I would have to do, I will put it in the chat as we begin with the first presentation. But that is a general overview of what happened at our last webinar. So if you like what you see, please encourage others to join us. And word of mouth has been known to be the best tool to make sure that folks join us. Today is a very interesting day because in the US, we are just ending the holiday season, holiday weekend. And so some folks may have taken a couple more days off or may not be, or may be catching up from holidays. So, but nevertheless, this webinar is being recorded and will be made available for folks to continue viewing and sharing with others. And now it's, a true honor and a privilege, to introduce Sylvia Castillo and her amazing work. Let me tell you, this has been incredibly busy season. And in the middle of it all, Sylvia was gracious enough to make time for us to share some of the deep knowledge that she has and carries. And and I first partnered with Sylvia, I think more concretely in Fresno, as we held a town hall meeting on this specific coalition and the efforts of the coalition and the role that communities like the Fresno community could take on, on continuing doing this effort. So Sylvia, the floor is yours, and you can start sharing your screen as you like.
That's right. Let me do a screen share. There we go. Gracias, Angel. You're such a flatterer. It's also always an honor and a pleasure to work with you and see all that you are accomplishing for the folks in the Central Valley here in California, which people often forget. Those communities are extremely different to, let's say, San Francisco, the Bay Area, or Los Angeles County, that are, who are large cities with lots of funding support to go around compared to our poor rural communities in the Central Valley and in Northern California. But buenos días a todos. I got the opportunity to speak with Angel earlier last week to learn more about the organizations and the work that you all do. So I'm really excited to be here and share the work that we've been doing with the End The Epidemics Coalition. So as I mentioned earlier, my name is Sylvia Castillo, and I work with an organization called Essential Access Health. As part of Essential Access Health, we are one of the founding members of a statewide coalition called the End The Epidemics Coalition, and I'll share more about what our work in tandem with over 100 organizations across the state accomplishes. But today, the information that I will be sharing is focused on sharing the importance of communicating with your legislators. And I will also share some tips and best practices for planning and carrying out community action events where folks can meet with their legislators, especially right now during COVID through virtual legislative meetings, for example. So that's what will be covered for today. And we, the End The Epidemics Coalition, we recently hosted our annual Week of Action that was all conducted completely via Zoom with more than 100 participants across the state. And so I will be using that work as examples as we talk through about how to conduct legislative visits and engage folks in your communities. Let me advance the slides here. So the End The Epidemics Coalition, who are we? We are a statewide organization or a coalition that's composed of over actually close to 200 partners from across the state now. We all come together to advocate for anti-racist policies and funding priorities that eliminate inequities among Black, Indigenous, and people of color, all the while working collaboratively to end the endemics here in California of HIV, sexually transmitted infections, viral hepatitis, and overdose. So because of this wide breadth and scope of priorities that we have, our coalition members come from all sorts of walks throughout the state. We have research partners, local departments of public health, even the State of Department of Public Health participates in our work, in our advocacy work. Includes small organizations that work on harm reduction in rural communities. We have large organizations that represent statewide groups of advocates. We run the gamut, and we all come together every year to host an annual either Day of Action or Week of Action. Our priorities as a coalition is to urge our state leaders to step up and lead by embracing an initiative that will end all of these epidemics. So with that, we specifically ask for state dollars to be invested towards ending these epidemics. What your ask might be different, but I just wanted to share what it is that we work towards here through this coalition work. So why do we want to communicate with our legislators? Well, sharing your story accomplishes three main goals. One is to build relationship with lawmakers, and it doesn't necessarily have to be your state legislators or your Congress members. It can also be even administrators like the governor. It could be with the director of the Department of Public Health or Healthcare Services. Whoever has the power to do the thing that you need them to get done, that would be either the group of people, the office, the staff, or the actual person that you want to meet with. And the purpose of sharing a meeting with them is to inform them of an issue that's impacting either yourself, your family, your neighborhood, your community, issues impacting your organization, or even your clients, patients, or the communities that you work with and you serve. What's key here is that by you stepping up and communicating with your legislators and the power brokers where you're at, it shows the breadth and scope of how the community is impacted. If you don't talk about how HIV is impacting folks in your specific region of the state or in your specific region of the world, then those legislators are not going to know what is happening in that area. That's why they need to hear from you. And most often it's when either the patients, let's say, for example, living with these conditions, or family members that take care of people living with these conditions, when they share those stories with legislators, that's when they are more willing and understanding and more willing to take steps or take those actions that you need to get them to do, whether it's to, fund certain priorities that you're aiming for, or to pass a bill, support a new law, create a new law, change a law, or even get rid of a law that's getting in the way of your organization or your clients and patients getting the resources that they need. That is the ultimate goal. So holding virtual legislative visits. We are living in, obviously we are living through times that are unprecedented, although at this point we're a little more used to things now that we are a year into the COVID-19 pandemic. Here in California, at least, I can't speak for the rest of the country or what's happening in your countries that you're representing. Everything has gone virtual. So meetings with legislators have still been happening. Meetings with power brokers have still been happening all along, but everything has gone virtual. Just to give an example, the End The Epidemics Coalition, we used to host a one day of action where we would bring all of our partners, clients, and patients to Sacramento, our state capital. And we would go into the Capitol building and pretty much knock on doors and meet with as many legislators as possible. Of course, because of the pandemic, this was no longer possible. So then we switched to doing a week of action and all conducting virtually. And I'll share more about how that worked out. But first off, as your organization is assessing, how do we want to engage community members? Do we want to meet with legislators? You first have to ask yourselves, what is your ask? Again, are you asking for money to be allocated to a certain issue? Are you asking legislators to support a specific bill that will change a law, create a new law, or get rid of a law, or somehow do any of that? The next question to ask yourself is, who holds the power? So which legislators or administrators need to be targeted? The example that we give of who are the legislators that we met during our week of action for the End The Epidemics Coalition was we decided to target, because our requests are specific to funding, getting the state to invest state tax dollars to fight the epidemics. We met specifically with all of the legislators that sit on the budget committees and the appropriation committees, because they're the ones that get to vote where state tax dollars go towards. So we met with those, and we also met with the governor's office, as well as administrators with the Department of Healthcare Services and the Department of Public Health for the priorities that we're supporting. The next question to ask is, whose stories must be lifted up? Who needs to be at that table during those meetings? For example, is it your organization's CEO? Or maybe your organization, your community health workers that are out in the communities working with the people, because they have the important stories that they can share with legislators. Do you want to bring your actual clients and patients themselves to participate so they can be empowered to share their own story with those legislators? Who else do we need? Do we need, for example, in California, the questions that we were asking ourselves as a coalition is, whose voices need to be lifted up? And we realized we don't have enough voices from the Central Valley, from the rural Imperial Valley, which is close to the California-Mexico border. We wanted more voices from rural Northern California, because most of us folks in the coalition were either from San Francisco or Los Angeles. So we went and did the legwork to recruit more partners from those regions to make sure that their voices were heard. That's just one example. And the next question to ask is, what are your resources and what's your organization's capacity? Because we all want to meet with all legislators, but if we have very small capacity, it's only maybe one person organizing this, you must decide, do we want to meet with one or two legislators or lawmakers? Do we want to host a whole day event, or do we have the capacity to put together a week-long event? That's what you also need to assess as you're moving forward and creating your own action events. I'm showing you this slide as an example of the activities that we decided to host as a coalition. Again, because we are a large coalition, we did have the capacity to expand our event from 1 day to a 5-day event. And not only that, but because we had such a large list of folks that we wanted to meet with, we realized we can't do that via Zoom in 1 day. We need more than 1 day to host those virtual meetings. And so the way we organized the week was, the first day, we did advocacy trainings, and advocacy training is the key element to planning any action activities. The people that are going to be meeting with legislators may not always be comfortable, talking in public or speaking with lawmakers. They might be nervous. So they would appreciate some sort of training, explaining to them what the process is, what it's going to look like, and what they should talk about. And so that's what we did during those advocacy trainings on day 1 of our week of action. Then days 2, 3, and 4, so Tuesday, Wednesday, Thursday, those were the actual days where the meetings took place. And you'll see here that each day has a theme assigned, because the other way that we engage with legislators was through social media. I'm sure I don't have to share this with you all. You probably already know this, but social media now is a key and important way to communicate with legislators publicly and put pressure. And most of them, if not all of them, do listen and pay attention to what people say about them or to them through social media. So we actually created a social media toolkit that we gave to all of our participants and shared with them and asked them, if you have social media pages, please engage with all of these legislators. Here's some sample messages that you can use, some graphics, some images. And each day had a theme, and that's what the days that you see there. For example, Monday was mobilizing to end the epidemics. Tuesday, our social media focused on centering racial justice, and so forth is how we went through the rest of the week. We also engaged folks. One of the key elements for weeks of action is to engage folks through multiple avenues. Yes, you have an advocacy training. Yes, you have legislative visits. You also have social media engaging with folks online. But then this year, we actually decided to expand on that work. And so we included a workshop for understanding racial justice and how it relates to all of the epidemics that we're facing here in California. And so that was a workshop that we hosted. We actually had more people attend that workshop than participated in the actual legislative visits. It was such a popular workshop that we were excited to have, which is still recorded and available. So if you're all interested, we can definitely send you that link. I'll share that with Angel. And of course, one of the key elements we noticed this time was it was important to add some sort of social event. Had our action day taken place in person, at the end of the day, we would have hosted some sort of social event where folks could just relax, meet, and talk with each other. Last year, when we switched to this online virtual format, we realized that people really missed that. And so this year we decided to host the Zoom happy hour. It was just an hour long where whoever wanted to join did, whoever needed to vent, share personal stories, talk about how the week went. They had that opportunity, and it was an overall positive event. Again, this is just one sample of the type of activities that can take place over a week. And certainly a lot of this can be condensed to a single day if that would suit your organization's needs. So the way we arranged the advocacy meetings was we ended up doing, I think it was 35 legislative visits, 35 meetings during that 3-day period. Actually, it expanded to 4 days. And we organized it the way we would have in person. So we organized folks into small groups of about 10 people. Each group had 2 team leaders that shared the work. But each meeting could have been with different leaders, etc. The role of those team leaders was to send all of the materials to their group members, confirm the meetings with the legislative offices or administrative offices, and then again, share that information back with their team members. They sort of served as the coalition ambassadors for their small groups. So for folks that are doing virtual visits, here are some best practices that we've learned so far. We're still learning, right? We definitely encourage folks to join by video. If possible, it is highly encouraged. We still want to see that, have that visual interaction with our legislative members. We definitely have to remind folks, make sure you're in a private location, reduce your background noise, make sure you have a stable internet connection, whether it's through your laptop or through your cell phone, using the video option. We remind folks, check your background, make sure it's not inappropriate. It doesn't have to be something fancy, it just has to be appropriate. Avoid inappropriate things. And we remind folks, of course, even though this is done through virtual modalities, yes, we're working from home. Some of us get to work from home, but we still have to dress appropriately. Not everybody needs a tie, but we definitely, want to be cautious of the types of t-shirts that we're wearing. And actually for our last year's online action event, we actually did send out folks t-shirts. And so some folks wore those same t-shirts this year that had our End The Epidemics tagline. If that's still possible for you all, that's actually it makes for a great, really effective photo when you do it through Zoom. The way we set up the legislative visits was we set up timeframes of 1 hour and 15 minutes. When folks logged on at the beginning of the meeting, it was actually just the 10 participants with the team leaders, and they used that time to prepare, to answer any questions, do practice runs of how to share your story. And they had 30 minutes to do that preparation. And then at the 30-minute mark is when the legislative office or team or staff, or even the legislator themselves, joined the meeting. They had their discussion. Then when the legislator or legislative staff left, the group still stayed to debrief for up to 15 minutes. The debrief is actually really key, especially if your small groups are composed of people that have never advocated or met with their legislators before. They will usually have a lot to say after. And again, you can provide feedback. So just as an example, let's say there was a legislative meeting at 10, the groups met at 9:30 to do their prep. The meeting started at 10, ended at 10:30, and then at 10:30, the debrief began. So this is an example of what the time frame looked like. During the preparation time, again, the team leaders will decide who covers what issues. So your participants, who's comfortable talking about what. So for us, for example, it was who's going to talk about our HIV funding requests, who's going to talk about overdose prevention, who's going to talk about sexually transmitted infections. And you break up the issues that you need to discuss in that manner. You decide who will be the note taker, and then submits them to the team leader. Then when the meeting actual starts, the team leader usually will, the way the legislative visit will work, where everybody will introduce themselves. Then you'll go dive into whatever your assigned issue is, share your personal or work stories. And then at least one person needs to go in and do the actual ask. Will Senator so-and-so support bill number 123? Yes or no? You have to go in and make that specific ask. They may not always answer. They may say, I can't commit right now, but that's so important to know, because if they haven't said no, then there's still a chance you can influence them to support whatever it is that you need them to support. We can skip this part about the debrief. The other key part during your prep time is practicing your story, or getting your participants to practice their story. One of the methods that we like to share with participants, and when we invite them to share their story, is to use what's known as the hook, line, sinker method. This is a metaphor like fishing. You start with your hook, where you briefly introduce yourself, share what community you come from, what your point of view is. Like, are you a parent? Are you a medical provider? Are you a service provider? Or are you a person, let's say, living with HIV? You share that. And then you share your line. You share why you care about the issues you care about. Share your real life example. Share any data, any information, whatever strengthens your argument. And then you go in with the sinker. You make the request. Will you support this issue? Will you vote to X, Y, Z? And so that's that simple hook, line, and sinker method, which is, again, a fishing metaphor. Some other tips for sharing your story is you have to have a guiding question. Why does this issue matter to you specifically? You should keep the details concise. So don't just go automatic and start telling your whole life story. Keep it focused on why this issue matters to you. It's okay to let your emotions show. Openness will help others relate to your message. And then lastly, stay committed to the truth. It's important that you do not exaggerate your story just because you think it might be more convincing. Definitely don't lie. Just stick to the truth, and the honesty will show through. The last piece that I wanted to share is, like I mentioned earlier, during whatever your community action event, it's really important to connect with your participants through multiple ways. Engage them on social media, invite them to the legislative visits. For us, for the End The Epidemics Coalition, we created an online virtual action center that during the week we kept encouraging everybody to go to. That's where they could find all of their meeting materials. Even if they couldn't attend legislative visits, they could take action online and send emails to their legislators, and then they were able to download the social media toolkit. The final way that we communicated with our partners was through a text messaging program. Folks were able to sign up to get text alerts and actually even text and send emails that way through to their legislators. This is an example of the one that we did. And if you still want, you can still sign up and get these alerts from the End The Epidemics Coalition. And I'll pause there for some questions. I know I threw a lot of information. I think I went way over my time, but I don't know, Angel, how much time do we have for questions?
We have another 10 minutes, and then we're going to take a 5-minute break, 5-minute bio break before our next presenter joins us. So 10 minutes, any questions, you can type the questions on the chat, or you can unmute yourself and ask Sylvia the question directly. maybe, Sylvia, I have a question with
Sure.
regards to some of the results, and maybe could you speak a little about some of the challenges with the advocacy efforts, as well as some of the highlights. And I'm talking specifically around, some of the budget wins that have happened.
Sure, absolutely. So with some of the highlights I can share also even from hosting this virtual week of action, we had close to 200 people register to participate through various activities. We had about close to 100 that participated in legislative visits. And again, this is already our 4th annual action event, whether it used to be a day event in person, and now the last 2 years have been a week-long actions, all conducted through Zoom, through virtual methods. So our coalition, again, our main advocacy goals is to get legislators to invest in funding ending the epidemics, programs that will end these epidemics. We've been very lucky because we've been persistent. We've had a strong number of organizations participate in the coalition and help advance this work. And we've had some legislative successes over the last few years. I believe it was the years blend now with COVID. I feel like 2020, it's like that year that's going to be kind of sort of forgotten. But I think it was in 2019 where we were able to secure a total of $17 million to be invested towards ending specifically HIV, STIs, and hepatitis C at that time. When that funding was given, and this funding was given over to the Department of Public Health, that then distributed that funding to local departments across the state as needed. So funding was given to rural communities, to large urban centers that had high rates of HIV, STI, and hepatitis C. And then the local departments were required, the way we wrote that piece of legislation is that they were required to grant out half of that funding to local community organizations that were doing that work. And that was really key because when you, at least, again, I know we have international partners, but here in California, at least, each region is completely different. So we have regions that where the local departments are really good at working with partners and doing a lot of progressive, programming to help reduce HIV, STIs, and hepatitis C. But then we have other regions that, politically they're a little more conservative, aren't doing enough work to address these issues in their local areas. And so for those areas, that's why we wanted to make sure that they were forced to work with the local partners that were already doing this work and are doing excellent things in their local communities. And then again, we were lucky that during 2020, that funding that we got, actually in 2019, when we received that funding, we were told it'll be in place for 5 years. So in 5 years, we're going to have to advocate to get more of that money. Well, in 2020, because of the COVID pandemic, the state realized they don't invest a lot of money in public health. So let's not take money away. And those $17 million that we secured for the Department of Public Health was made permanent and ongoing, which meant we didn't have to keep fighting for that amount in the future. But that left us open to now this year, try to increase that money, not just fight to keep it, but actually invest more. And so that's what we're working on right now over the next month. And we're hoping to have secure some more wins to get money invested.
Sylvia, thank you so much. There is a question that if you would be so kind to answer via chat, that is coming from Trevor. Truly appreciate that. And I know that Michae has joined us. And so Michae, just to let you know, I have made you co-host so that you can also share your screen once Sylvia stops sharing theirs or hers. And just letting you know in terms of the flow of the program, we are going to take a 5-minute bio break and then come back to continue with your presentation. Sylvia, mil gracias, muchísimas gracias. You are amazing, and looking forward to continuing partnering with you and with the coalition. Yeah.
Thank you. And I can answer really quick Trevor's question. Do we provide talking points to legislators to help them engage with other legislators on an issue? We absolutely do. We will actually feed them, here's some talking points, use them when you can during the hearings, use it to advocate with other members of your legislative committee so they can vote yes. Yes, we absolutely do. We even have worked with legislators to submit opinion pieces to their local newspapers. We actually got one senator, Senator Scott Wiener in San Francisco, to do that. So there was this large article printed in the local newspaper saying we need to secure more funding, invest in preventing HIV. So that was a really awesome project to work on. And they were more than happy to help, add their name to the stuff that we help them submit and write for them. So yes, we do that. And that's important and that's key, because even though legislators might be passionate about an issue, they might not have the expertise or even the words to use to describe it. So it's okay, you can feed them some of those words. And I'll stop sharing my screen now. Okay, thank you.
Thank you so much, Sylvia. And again, this presentation will be made available through our YouTube channel so that it can be shared. And with Sylvia's permission, if we can share your slides as well. Yes, thank you. And just whenever you are able to send them out my way, I can send them out to the attendees as well. What I'm also including in the chat box is the recording of the last webinar. If you are interested in seeing and learning more about the research tools, you can go to that YouTube channel and the recording is there. So we will take a 5-minute bio break, and then we will be back to learn and continue sharing our experiences with Michae, with the Translatina Coalition. Okay, I'll see you in 5 minutes.
Thank you, everyone. Gracias, Ángel.
A ti. Welcome back, everyone. For those of you who are still with us or near your computer, if you could please type in the chat again, your name, your preferred pronouns, if any, the organization and the country perhaps that you are joining us from, just so that we can welcome our next presenter. And you can do that through the chat function, please. And I'll put those instructions in the chat function now. So welcome back, everyone. Thank you for joining us after here in the US after a holiday weekend. I know it's tough, but we appreciate you. We honor the fact that you made it back and are joining us. And as the introductions keep rolling in, again, my name is Angel Fabian. I'm the Advocacy Coordinator with the Fíjate Bien program at Impact Global Action for Gay Men's Health and Rights. And this is the second in a series of workshops that are aimed to deepen our advocacy skills and our communal advocacy skills. As I shared earlier, last fall, and actually the previous year, we shared with community an advocacy curriculum that we have been working with for the last 10 years, mostly in the Global South, with community-based organizations, grassroots organizations that are doing advocacy work in the LGBTQI communities. And we introduced it here in the States. We started with in Oakland, went to Fresno, introduced it in the Central Valley, and went to the US-Mexico border and finalized it in Puerto Rico. And it was aimed at, engaging community around advocacy and the importance around advocacy. And this is a continuation of some of those workshops. That particular curriculum that we have been using for 10 years with community is a module of around, it has 10 modules. And so it's almost a 5-day training session that we usually have in country. So we had to break it apart. And then, because of COVID, we had to put it on a virtual platform. And so, so here we are. And I am extremely delighted to welcome Michae de la Cuadra. Michae is a genderless being that is working towards financial, social, and political liberation for many communities she is a part of. Currently, Michae is working with the Translatin Coalition as the manager of policy and community engagement, where she is changing the political presence of trans folks of color and working towards accountability from political systems through trans-inclusive legislation. And let me tell you, Michae is my shero. She is doing some kick-ass, amazing, throw down no bars work, and it's an honor and a privilege for you to join us, Michae, and share some of your wisdom and your knowledge. And I have made you a co-host, so if you would like to share your screen, you can do so. Welcome.
Thank you so much. That meant so much. Thank you for the wonderful introduction. Hi, everyone. My name is Michae. I, like they just said, I work with the Translatin Coalition right now, and I've been there for about 3 years. And since I've been there, I've worked to really build up the policy platform for the organization, as well as working with other trans people, trans-led organizations across California to create legislation and pass legislation that's going to move our community forward. For so long, you know, trans people haven't been in legislative spaces, policy spaces, especially folks of color. And so it's been really amazing to see that grow and to see conversations happening in the Capitol that are really centering the real experiences that people are going through here locally in the cities and in rural places across California. So it's been an honor to do this work. I want to ask before, I know that the previous presentation was regarding legislative meetings, and I know a piece of my presentation is talking a little bit about how to pass a bill. I'm wondering kind of if folks can give me like a sense of where they are in terms of how much they know about the legislative process, so that way I don't just like go into, you know, how to pass a bill if everyone already knows how to do that already. So if you could put like from a 1 to 5, how well do you know how the like a bill becomes a law type process? That would help me know how in depth I should go for my portion of the presentation, if people can do that for me. Okay, cool. So I'm guessing 1 and 2 are like lower numbers, right? From 1 to 5, 5 would be like, you know, everything. So that's a good sense then. I'll go into this then. Okay. Okay, a 5, we got a 5. A lot of people are giving a 2, so I'm gonna get into this real quick. So this specific slide deck is one that I use to give a policy 101 to our staff at the organization. So it is a little bit more playful. It's not super professional, super serious. I feel like the way I do this work is kind of being professional when I have to be, when it's like around legislators, around people in the Capitol, and doing that work when I need to. And at the same time, I feel like professionalism sometimes is really harmful, and it's really, it's policing, and I just don't like, I like to keep it a little bit more informal, and I feel like people learn best that way too. So that's why this one's like a little bit more cute, just FYI. So I'm gonna share a little bit about the policy department. I shared a little bit about the work that I've done there so far, but I would love to go to more in depth around how we came up with these bills that we created, how we got to where we did with AB 2218, which I'm gonna be talking about in my presentation as well, what that is, and how you can support where it is now. So the policy department at our organization for the longest time was a 1-person team, which was me, and Bambi Salcedo, who is our president and CEO. But a lot of the work that I was doing was trying to find legislators that would be willing to work with us on policies, trying to build with other trans people and organizations to, you know, start to build power across the state so that it wasn't just our organization doing policy work, because that's not sustainable or realistic. And so the goals that we have for our organization are to pass legislation that advances equity for the trans community, transgender, nonconforming, and intersex community at local and state levels, to build relationships with elected officials and stakeholders to increase visibility and awareness for TGI communities, and increase the political engagement of TGI communities locally and statewide. So we've been able to do this so much in the last 2-3 years. And so these were goals that we set at the like kind of start of when I started working with the organization. So it's been really beautiful to see that culmination. For folks that don't know, I'm gonna drop it in the chat as well. In 2018, we developed a report which was called the Trans Policy Agenda. I was the lead author of this report, and we did a statewide survey of about 160 trans people that were across the state, and ask them, what are some policy priorities? What are some issues you face in 5 different areas of your lives, from health to like identity documents, like trying to touch on different aspects. And we used a lot of the information that we got from that survey and from focus groups that we did in LA to create this report that consists of over 40 policy recommendations that are specific to transgender, non-conforming, and intersex people. So you'll be able to find things from policing, from healthcare, from economic justice, and it's been a resource not only for our organization and other trans-led organizations, but it's been a resource for a lot of ally organizations thinking about how they can make their policy work more inclusive from a lens of trans justice. Because a lot of the times, a lot of the work that organizations do, they don't include a trans lens, and a lot of the issues, even if it's not a trans specific issue, will still impact trans people. So this is a really good resource if you've never seen it before. I believe I put it in the chat if you want to check it out. And so we wrote that in 2018, and we actually wrote the ideas for AB 2218, which is the Transgender Wellness and Equity Fund, which was about allocating resources for holistic health services for trans people, and SB 132, which deals with housing for trans people that are inside California prisons. So that bill also passed last year that allows people to choose their housing placement based on their gender identity or their perception of health and safety. And so both of those bill ideas were actually written into that report 2 years ago. And so to see the kind of progress that was made and to have them actually become like state law has been like a really, really kind of wild thing to see. But please check that out if you haven't already. And so policy, legislation, bills, they're all like, all of that language is used interchangeably. And I like to say that it's a simple and complicated answer. It's simple because I feel like once you understand the process, it feels pretty easy. But I think kind of learning it at the start, it can be really, really complicated. And I think it's meant to be that way. Just to like kind of, if everyone knew how to do policy, we would be in a better world, right? But that's not the reality of the situation. And so a lot of the times we're learning this process as we're going, and we're pushing and trying to just, get the resources or get the rights that we deserve. And that's been a lot of like what it's been like for our organization, is just kind of learning as we're going and kind of becoming more fluent as we go along. But a policy outlines what a government hopes to achieve and the method or principles in which it will achieve them. So if we're aiming for healthcare access for trans people, the method that we would hope to get to that would be to create a fund that would allocate money to create or sustain health services. So a policy, typically that language is not necessarily a law, but it becomes a law if signed by the governor. And so the way that the process works is, you come up with a bill idea, kind of like the ones written in the policy agenda. And these a lot of the time are most effective when they come from the communities that are going to be the most impacted. So, we're writing trans legislation, TGI legislation, because we are TGI people and we know what's going on. I know the experiences that I go through, and also the people that I love and see every day what they go through too. And so it's made our policy work a lot more effective because we're directly related to the policies that we're hoping to create. And a lot of the time that isn't necessarily the situation, but those ideas come best from community, and then finding a legislator and things like that would be like the next step. But ultimately, a policy, the end goal is for it to become a law. So like I said, communities, people, organizations, folks get together to identify a problem that's happening in their community. That can be something as big as, we really need more housing here, from something really specific to, I want to change this specific language in the penal code to change this one word that actually makes people get more time in jail. Like it can be really, really specific to the point where, you're trying to pass a bill to get a specific sentence changed in an already existing law. or create a new law in itself. So depending on what the specifics of the organization are, or the coalition, or the people, that determines kind of what policy would be created. And then from there, I feel like in an ideal world, it would be great to be able to work on a policy just as a community and not necessarily have to work with the legislator, but to make policy happen in a state context, in a federal context, in a local context, you need to work in collaboration with the legislator. And so a lot of the times people and organizations will connect with the legislator that is in their specific district. And so the way that the California legislature is split up is that there's a Senate side and then there's an assembly side. So you can introduce legislation with either a senator or an assembly member. It can be either or. And depending on where you live, your district that you live in has both a senator and an assembly member. So you would be able to ask both of them, and sometimes they'll even work together on your legislation as well. So for our specific policy, AB 2218, the health bill, we reached out to Assembly Member Santiago, who represents Translatin Coalition's district, which is like downtown going up to Koreatown area. And so we were meeting with them way before we even planned to introduce the bill. So I think like bills normally have to be introduced in January. And we were meeting with them maybe like 3 or 4 months before that, because a lot of the time legislators finalize their package really, really quickly. And they, will be full of bills and won't take on any more by the time that January hits. So, a legislator really kind of determines the fate of the bill. And since it's in their hands and their name is on it, a lot of the time you need to be kind of cautious because they have ultimate control of the bill. There have been situations, not necessarily with us, we've been really grateful that Santiago is really supportive, but there have been situations in the past where people will be working on a bill, and then they're like, they get to a point in the process where they're met with the decision of, you need to take out this language for it to pass. And that language is really, really important to the organizations or the coalition working on it. And ultimately, the legislator has the ultimate say of whether or not they'll take that amendment or not, which is really, really scary because it can kind of change the whole trajectory of the bill. And so that's just like kind of the scary parts of working with legislators. But luckily, I've had like a really good experience. I know the previous presenter mentioned Senator Wiener. He's been really amazing and worked with us on SB 132 and has been just like really down to follow the lead of the people that are working on the issues and not just be like a legislator that's going to make the final say on things. So, only the legislators can really work on or create legislation. And so if they're interested in your proposal, and to find a legislator, you would do kind of the things that they were mentioning in the previous presentation, setting up meetings, taking some talking points on the issue that you're working on, and asking if they would be interested in turning this into legislation. And if you do that enough, most likely and early enough, you'll be able to work with a legislator to create a bill. So that's a lot of the beginning kind of process. If there are any questions, like please type them in the chat and I can see when they come up. Like I said a little bit earlier, the Assembly and the California legislators split up into two kind of houses. And so there's the Assembly and then there's the Senate. Can everyone see my mouse? I'm not going to show that because I'm like kind of trying to guide with my mouse. So I'm making sure that people can see it. Can you see it?
Yes, we can see it.
Okay, cool. So at the beginning, there's the idea for the bill, which we talked a little bit about already. The biggest parts of the bill's life are these things called committees. So the way that these committees are set up they're set up by issue area. And so there's a ton of different committees on both the Senate and Assembly. And so oftentimes when you're doing a bill, you'll hear something like, oh, our bill is going to the subcommittee on Health and Human Services or the policy committee on Health and Human Services. If your bill is specifically related to healthcare, it'll go to a health specific committee. And within that committee, there's about a handful of legislators that are really passionate about that specific issue area. So there will be about like 7 or 8 legislators that sit on that committee from the larger number of legislators, because there's about 80 in the Assembly and about 40 in the Senate, and about 7 or 8 will be on these committees. And so when you go through that committee, basically you're presenting your bill with your legislator, talking about why it's important, talking about why it needs to be passed. And if enough legislators believe or care about what you're doing and believe it's not an issue that should be prioritized, it'll get passed through. If you don't get the majority number of yes votes in these committees, then your bill will die, which means that it will not move on to the next stage in its process. And it will basically, you'll have to wait next year to try it again. And so these committees happen depending on issue area. If it touches 2 committees, like one, you're doing a health bill, but it also is asking for resources, then it'll go to the health committee and like the appropriations committee, which handles money. And so you would have to get through both. And so once you go through these committees, then you go into the floor vote, which is basically every single member has to vote on the bill. And if you get a majority, so in the Assembly, I believe there's 80, there's might be a little bit more, but it's around 80. You have to get at least 41. And then in the Senate, you would have to get over 21 if the number was 40. And then basically you go through that exact same process on the other side. And then eventually, after going through all of that, you get to the governor's desk, and that's ultimately where he has the final say of whether or not your bill will get signed, whether or not it will get vetoed, or whether or not it'll just kind of stay like a limbo bill. So basically you can go through that whole process, the governor be like, I still don't know enough about this, I'm not sure we should sign it, do that years long of work, because the process is about from January. The committees take place throughout, start around like March, go through May. And then, at the deadline for signing a bill is in October. And so you can go through that entire year-long process and still end up at the end of it getting a veto and having to try again next year. So it's just been, it's really, really scary. But that's basically how the process works in a very synthesized way. I think going into like the whole policy process can be a bit long. So I tried to summarize it as best I could. But to talk a little bit more, and feel free to ask any questions because I know that was a little bit fast, but I'm gonna transition into AB 2218, which is the current kind of policy priority, budget request priority that we have for our organization this year. And so last year, well, in 2019, we had, seen the California's governor's proposed budget. And so California releases a budget every single year in January. And it basically lays out how spending should be allocated across various different state departments, from health services, prisons always get the most money, from like education to elderly services, everything is written in there. And so the first time that we read that budget, there was not any light item for trans people, but let alone like LGBTQ plus people, which was really, really surprising, because if like, lesbian, gay, bisexual people aren't getting money like either, what does that mean for trans people who are like even more marginalized than those people? And so when we had read that initial budget in 2019, we created a budget request letter that basically outlined like what our priorities would be as an organization and as a coalition, because at the time we were working with about 5 other orgs, which was the Transgender Health and Wellness Center in the Inland Empire, the Gender Justice LA here in Los Angeles, Transgender Intersex Justice Project in the Bay Area, and I believe, and then I think the Gender Health Center in Sacramento. And so we had created a budget letter that outlined, 5 different key priority areas that we believe needed to be funded to really improve the lives of TGI people across the state of California. And so we started to have those legislative meetings with legislators about this specific budget letter. We met with a bunch of people from Santiago's office, a bunch of senators, a bunch of assembly members, And eventually, Assembly Member Santiago at the end of 2019 was willing to take on the health component of our larger budget request that we created. And so our specific proposal was asking for funding and the creation of a Transgender Wellness and Equity Fund within the Department of Public Health to allocate grants to trans or TGI-led organizations across the state. And so at the end of 2019, they agreed to take on the bill. And then at the start of 2020, we were able to get the bill number, which was AB 2218. And then in March, the global pandemic happened. So all of the advocacy that we did was virtual. And so we went through the entire legislative process that I just explained in 2020. And throughout the entire process, we were being told that, this isn't something that will likely pass this year. This isn't something that is really a priority right now because we're really only prioritizing COVID specific issues. And, apparently trans people aren't affected by COVID. So it was just like really discouraging out and throughout the entire process, but we continued to push. And so we did so many different actions, from call-ins to the governor, call-ins to the different committees, having people write letters, having a selfie campaign, doing a press conference, doing Twitter storms, mobilizing for public comments. And we were doing so many different things throughout the process to really show that this was something that needed to be prioritized. And so in September, it was finally passed. And so they signed AB 2218 into law, which established the Transgender Wellness and Equity Fund in the Department of Public Health, but they didn't allocate any money to it. And so when we talked to the Department of Public Health, they told us that we can't do anything with this bill until there's money allocated. So basically, there's a policy process, which I explained, and then there's a budget process, which is kind of very different than the policy process. And so we were being told that you have to go through this process for another year to even get this fund started. And so that's what we've been doing this year. We've been meeting with legislators. We introduced a budget letter with both the LGBT caucus and Santiago's office. And we were being told by pretty much everyone in the Capitol, from the Assembly and Senate Budget Subcommittee chairs, from the governor's office, from the Department of Finance, the people that handle the money, we were being told, you're in a really good place. You just passed this bill this year. There's a surplus. There's a lot of money to be given to new initiatives, and it's looking really good for you. And so when the governor's revised budget came out in May 15th, the funding for this specific bill wasn't included. And so we were really disappointed, really shocked, really discouraged, really frustrated. A lot of feelings were going on within our coalition. We've been trying to really use this time between that news on May 15th and between the final budget deadline, which is June 15th, to kind of figure out what we're going to do as a final push. And so we're going to be using these last 2 weeks to do press conferences, Twitter storms, calls to the governor to really have him prioritize this as something that should get a budget allocation. We've been working with a coalition that was built towards the end of last year that's known as the California TGI Policy Alliance now. The acronym is CTPA, we say CATPA. And it's a coalition of over 20 plus TGI-led organizations across the state. And so it's been really beautiful to engage all these different organizations through this process to get to where we are now. And for California and legislators to be really shocked that there are even this many trans-led, TGI-led organizations across the state, because they didn't even know that there was one. And then when they found out about Translatin Coalition, they thought that we were the only one. And so it's been really great to increase our presence, to create conversations, and to do all the things. But that's a little bit about kind of where we're at right now. And I would love to be able to stay connected with anyone that's interested in these next 2 weeks for how we're planning to support and engage with people. I know that I had 30 minutes, so I want to make sure that there's time for questions too. But that's a little bit about just, the overall legislative process and a little bit about, AB 2218, which is this like really historic bill that was created here in California. It's one of the first bills like this to have been created that actually creates a pocket of where funding can be allocated specifically for trans communities in a state legislature. And so it's been really great to work on it. I kind of nerd out when I talk about it, and just happy to answer any questions. But if there's anything else you'd like me to talk about right now, please let me know. Yeah.
Thank you so much, Michae. Am I pronouncing your name correctly? Okay. So thank you so much for all this amazing work, and I've been, kind of, I've known and grew up with Bambi, and so I'm a full-hearted supporter, advocate, of all the work that is happening with the Translatin Coalition. Did you get any pushback with regards to moving this forward, and from whom?
Yeah, we did. We had a whole advocacy network trying to push to have this bill not be passed. They were called I think they were called like the detransition like advocacy group. And basically like the narrative that they were spreading was that, taxpayer dollars don't need to be utilized to fund trans health services. The majority of people that are trans end up detransitioning at some point in their lives. Like, this isn't like, we're people that have detransitions. Like, we know that this is the reality type thing. And they went really, really hard, like during various committees and like the floor votes. They mobilized like so many people, like not even just in California, but in like across the country. So they had like there was one, I think it was the Senate, it was like the Senate Health Committee, I think. And they like had so many people calling that our specific bill, and we had a lot of people too, that our specific bill was heard for about 2 hours. Yeah. But so there was a lot of opposition, but luckily a lot of the legislators here in California, because the narrative was like, this detransition thing, but also that it was about child sterilization, that we were asking for child sterilization, that we were asking for health services so we can give minors, hormones like non-consensually or whatever. And so a lot of the legislators were like, we don't know where you're coming up with this information. Like these organizations and these communities that are pushing for this bill are literally saying that this is about access and about equity, and y'all are saying it's about sterilization. Like, these things aren't adding up. And so luckily we did a lot of back end conversations with legislators through like lobbying or like meetings and stuff. And so that really helped too, but there was a lot of opposition. Not so much now in the budget request process, but more so in the policy process. Yeah.
Wonderful. And I know that there's a comment from Charles. Please share your contact as you go through the process. Great work. Yes, echoing that. Amazing. It's her story creation, in the making, so please stay tuned. Any other questions that, opening it up to the audience? Either you can unmute yourself and put your camera on if you feel comfortable, and ask away. If not, you can also use the chat function. I have a question. What is next? What is next in terms of getting this budget ask? And how much is the budget ask?
Oh, yes. So our budget ask is for $15 million, which is not a lot of money in the grand scheme of things. So we're like just hoping that they can give us, this whatever percent, which is not even like 1%. So it's $15 million that would be utilized over 2 years. So it's not even a 1-year thing, like it would be spread out. And so what's next is, between now and June 15th, we have a big opportunity to get included in the final budget. If it's not included in the final budget, in June, like in on the 15th, then we would have to go through this entire budget process again. And so, you know, right now we're prepping to have, you know, different social media actions, different calls to action for our supporters to be able to, you know, make their voices heard and to show that there's a lot of public support for this, which was made clear last year. Like we had a lot of support. But this year we kept it more low key because we were hearing that we were in a really good place. But now that we're in like kind of like an emergency mode where, you know, the actions aren't aligning with the words, before the 15th, like we really just have to push as much as we can to get it in there. And if it's not in there, then we would have to try again next year. So yeah, and then in terms of like the overall future of this coalition that's been built, you know, we did a whole retreat at the end of the last year. For Cat Paw, we did a values, you know, mission building process. And so now it's not just like, you know, Translatina Coalition doing like a lot of this work. It's like a lot of other TGI-led organizations that are also learning this process. So I'm really excited to just continue building the power of our community across the state, and hopefully for that to branch out into other states and for this to be a model for other states. So yeah, that's a little bit about, but our focus is just in these next 2 weeks, just kind of, you know, trying to get Newsom to allocate this, like these pennies in the larger scheme of things.
Newsom, for those that are not aware, that's our governor for the state of California. We have folks joining us from throughout the states as well, from Puerto Rico as well as from Africa. So just FYI. And this recording will also be part of our YouTube channel, and so could be accessed by our global network, which covers almost 120 different spots. Any other questions? Any other insight? If not, Michae, keep doing the work and let us know how we can, you know, in which way we can support y'all. You know, we have a global platform and we're connected with some pretty dope individuals that are doing, you know, advocacy work with people living with HIV, with the global sex work community, the global drug using community, and, you know, the global trans community as well. And so just let us know how we can continue lifting this very important voice. So thank you so much for making the time and sharing your wisdom and your knowledge, and truly see you and appreciate you.
Thank you. Thank you everyone for listening to me talk this early in the morning. Yeah, hit me up if you have any questions. For any folks in California, would love to connect. So my email's in the chat. Thank you.
Thank you, Michae. So if there are no other questions, I'm gonna start sharing my screen and let you know that, you know, our next webinar, we will be joined again by Lindsay from the Kaiser Community Foundation. And she is helping us also identify an activist who uses this data that she will be sharing. So the Kaiser Family Foundation, they have on their website, they have a tracking tool that follows the money, that follows all the resources that are currently being made available through the Ending the HIV Epidemics Initiative and all other funding sources. So Lindsay will be sharing with us where the money's at, you know, and how do we use the money to make sure that that money reaches communities that need it the most. So our next webinar is next Tuesday. Hopefully you and a friend, bring a friend, can join us, and it's entitled Follow the Money, Honey. So with that, I wanna thank everyone for making the time and the effort to join us. And again, we will hope to share space with you soon. Thank you so much, everyone.